because I think the biochemistry is actually so straightforward. When you actually take it apart and go, okay, this is what we require. And a lot of our work's been on trying to work out what's blocking this message of real food. And it's the processed food industry, it's the pharmaceutical industry, and it's religious ideology, which come together. So if you've got something which is so simple, what's stopping this message from going out, apart from the vested interest? What happens at a personal level? Do you know what that is?
I mean, there's on a personal level, you get hijacked and we talked about hormones change and dopamine and
Far, far simpler than that. Now, I know you've got kids.
Mhm,
What's the most important thing? So when you've made a mistake, admit it,
for sure.
say sorry, and I'll move on. And we teach it to our children. Sorry, you've stuffed up here. You've stuffed up. Say sorry to your sibling or whatever. Say to your mother, whatever. Just, you've made a mistake. You don't do it again. Admit that you've made the mistake, and we can all move on. We can all learn from that. And we've actually said sorry to our children for the food we gave them. Sorry, guys, got that one wrong. But we'd like to, let's all move on. And we've seen the health benefits for our children. And now it's really interesting watching our grandchildren grow up in a relatively low carb environment, watching our daughters' pregnancies as a low carb environment, without health problems for the mother or the child. But as a medical profession, as healthcare professionals, when was the last time your doctor actually looked you in the face and said, actually, sorry, I was completely and utterly wrong there? This doesn't happen. And whether or not that's an arrogance or a self-belief or a worry of litigation, it's the sooner we as a health profession actually admit we got it wrong, we can then move on. And the last time the medical profession said sorry was over thalidomide, which must be 50, 60 years ago now. And I think from rough recollection, 10 to 20,000 people around the world affected by thalidomide. Consider that to the billions of people which are now affected by metabolic health issues. This is a huge problem. The first thing I think we all need to do is to actually go, oops, sorry, got it wrong. Our textbooks were wrong. Our teachers were wrong. That generational education that we've been exposed to since 1910, which is the Flexner report, which changed everything from the US and Canada, and then the rest of the world, that we got it wrong because propaganda was there at the beginning in 1910 with Rockefeller and Carnegie, and then the Flexner report and the birth of the pharmaceutical industry, the reduction of holistic health as an educational facilities. I think it closed just over 50 universities in the US and Canada alone, just based on the Flexner report. So holistic medicine went out the window. Preventative health was put right down, and the birth of the pharmaceutical and arguably the surgical industry just exploded. And then the food industry with its dietary guidelines was 1923. October 23, 1917, just to be exact, with the birth of the American Dietetics Association, and then all the textbooks being written for the rest of the world, and then the formation of the Canadian Dietetics Association, the Australian, the British, that all followed suit on the American model. Again, I mentioned Leonard Cooper. Leonard Cooper had been working for John Harvey Kellogg. This religious ideology of vegan vegetarianism came through. And so all the textbooks were like that. And that's generational education. So we struggle to question our teachers. We certainly struggle to question our textbooks because we believe those. They must be right. They've been thoroughly reviewed and edited, and they've stood the passage of time. But when you realize that they were written by the pharmaceutical industry and the food industry, here's a little one. Belinda came across this recently. At that very first American Dietetics Association, when it was formed, they had a meeting. They'd made a decision. I think there were about 50 women there. I'm not being sexist. That's just what there were 50 women. They had a meeting. I think it was probably 6 weeks' notice, 8 weeks' notice that they were going to have this form up and then develop the association. At that first meeting, half a dozen food industry companies were there to support them, even before they'd formed. So the food industry, very smart. They wanted to be there at day one. And I wasn't there to see the checkbooks, how much money, but nonetheless, there was influence on day one of the formation of the American Dietetics Association, which has then flowed on to continue the critical role of the food industry in dietetic information for the world. The formation of most of the journals around nutrition were by the food industry, for the food industry. They were all about, the vast majority of all of these articles is about improving quality of food, profitability, palatability, transportability. And somewhere, which was really nutrition science, was there to improve the product and for profitability of the food industry. Somewhere along the line, that margin's been blurred. So we believe that nutrition science is the same as medical science. It's not. Medical science is for the improvement of patients. Sure, it's actually been swayed by the pharmaceutical industry dramatically about what medications are going to do the job, but it's there for the betterment of the patient. Nutrition science has been for the betterment of industry. So what time do we start believing nutrition science is actually medical science? I don't know when it happened, but those margins have certainly been blurred.
Crazy. Follow the money.
Or the religious ideology. That's the strange thing, because when you come, and again, I'm known for talking about this. This is largely Belinda's work. When you realise that the dietary guidelines of the world, the Western world, have effectively been influenced by Seventh-day Adventist beliefs. Again, John Harvey Kellogg's worked for the founding family, the Ellen G. White, and he was put through medical school. And then he had the beliefs that the Seventh-day Adventists believe essentially fruitarian initially, but essentially a vegan concept, because they believe in the Garden of Eden diet, which is fruit, nuts, and seeds. It's not even vegetables. And they start twisting that a little bit around to actually make it into cereals, calling cereals wheat and rice to actually be fruit, which is pretty loose, but nonetheless, they've actually got that. But essentially, it's a vegan fruitarian diet, and that's their belief. And their belief is that when the world turns into vegan vegetarian, or believes in this vegan discussion and moves towards it, then Christ will return. Now, that's fine for you to have your beliefs, and we're not church bashers or religious bashers on this one, but this group, which is small in number, less than 20 million, is the second biggest educator in the world after the Catholic Church. They see medical evangelism as the right arm of the church. They are a major push into the developing nations of the world, enormous influence right through the dietary guidelines of the world since 1917. And we've got some of their early textbooks of the American Dietetics Association, and you read them, and they're demonizing meat and they're celebrating plant-based. And when you realize that Seventh-day Adventist Church started the cereal industry of the world in Battle Creek, Michigan, they also started the Western soy industry. John Harvey Kellogg started the alternate meat industry with the nut analogues. Again, this is all around 1900. Incredibly powerful, but that influence has then flown into the textbooks and it's flown into the medical education and that generational education, so that we start believing this non-science. But it's been there for over 100 years, and trying to unpick that. So again, I come back, if the biochemistry is fascinating, But that doesn't change. It hasn't changed in millennia. It's what we've been told and pushed is actually from industry. Seventh-day Adventist Church owned 14 different food industries, massive. It's just so well funded. They've gotten into very extremely high positions in the World Health Organization. 6 presidents and prime ministers of Polynesian countries are actually Seventh-day Adventists. Now, you might actually think that I'm being paranoid or conspiracy theory. However, in 2019, in a journal called Religion, so very senior people of the Seventh-day Adventist Church, there's an article where they actually acknowledge all of this, the role of the Seventh-day Adventist Church in manipulating the dietary guidelines of the world. It's not quite worded that, but effectively that's what they say. And in it, they quote Belinda's work. So Belinda's actually still in touch with very senior people in the church, in their educational aspects, very senior people currently involved in the church, a lot of past members, and they openly admit to it. So again, once you understand where the non-science is coming from, where the propaganda is coming from, and it is industry, pharmaceutical, and religious ideology, now I understand why I was conned in my medical education. Now I understand why the food pyramid is wrong. Now I understand why my food plate, whatever's coming out of the government, is being influenced by those factors. Because if the government admit they're wrong, it's a classic thing. Just admit we got it wrong and we can all move forward. And the obstacles towards low carb, particularly in diabetes, have been massive, except it's effective. But nobody makes any money out of it, except the local farmer.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
Once you understand where the non-science is coming from, where the propaganda is coming from, and it is industry, pharmaceutical, and religious ideology, now I understand why I was conned in my medical education.